Hi, I'm Dr. Mohit Kara, a urologist and professor of urology at Baylor College of Medicine. For over 2 decades, I've dedicated my practice to men's health, helping men of all ages reclaim confidence, vitality, and intimacy in their relationships. When we talk about stamina and intimacy after the age of 70, the very first thing we have to address is hormonal health. It's the foundation. Without balanced hormones, especially testosterone, everything else we do for energy, performance, and confidence becomes more difficult. Now, it's important to understand that testosterone isn't just a sexual hormone. It's a whole body hormone. It affects your mood, your motivation, your muscle mass, and even how your brain processes energy. Men who come to see me often say, "Dr. Kara, I just feel like my spark is gone. I'm tired all the time, my workouts don't feel the same, and I don't recover like I used to." These are classic signs that their testosterone levels might have declined with age. After 70, it's perfectly normal for testosterone levels to drop gradually, sometimes by as much as 1% per year starting from midlife. But what many men don't realize is that lifestyle factors can accelerate this decline. Poor sleep, lack of exercise, excess belly fat, alcohol, and chronic stress all interfere with natural testosterone production. That's why the first step in improving stamina isn't always medication. It's resetting the body's natural rhythm. I encourage my patients to start with the basics. Prioritize deep, consistent sleep, because testosterone is produced mainly during the night, in those deep REM cycles. If you're sleeping only 4 or 5 hours, you're short-changing your body's ability to regenerate hormones. Nutrition is another critical piece. A diet rich in lean proteins, healthy fats, and micronutrients like zinc, magnesium, and vitamin D can naturally support hormone balance. On the other hand, processed sugars and trans fats can suppress testosterone and increase inflammation, which harms blood vessels and energy levels. Then, there's body composition. Even modest weight loss, 5 to 10 pounds, can raise testosterone significantly, because excess fat tissue, particularly around the abdomen, converts testosterone into estrogen. I've seen men in their 70s reclaim vitality simply by adopting a gentle exercise program, combining resistance training and brisk walking. These habits don't just improve testosterone, they enhance blood flow, bone strength, and mental clarity. Now, for some men, lifestyle changes alone may not fully restore hormonal balance, and that's where medical evaluation becomes important. We measure total and free testosterone levels, along with other markers such as estradiol, DHEA, and thyroid function, to get a full picture. When appropriate, under careful supervision, testosterone replacement therapy can be extremely effective and safe. The key is to personalize the treatment, to use the lowest effective dose, monitor blood counts, prostate health, and cholesterol, and ensure the therapy truly improves quality of life rather than chasing numbers on a chart. My goal isn't just to raise testosterone, it's to help men feel alive again, more focused, confident, and connected to their partners. When hormones are in balance, stamina improves naturally, energy returns, and intimacy feels effortless again. Hormonal health is the first and most powerful pillar in restoring not just performance, but a sense of purpose and vitality that every man deserves, no matter his age. When we talk about stamina and performance after the age of 70, the next critical area we need to focus on is vascular health. This is something I emphasize with all my patients, because at its core, intimacy is a vascular event. Without healthy blood flow, it doesn't matter how good your hormones are or how strong your muscles may be. You simply can't achieve or maintain the physical response your body is designed for. The same arteries that supply blood to your heart and brain also feed the pelvic region. So, when I see changes in a man's stamina or control, it often gives me early clues about his cardiovascular health. In fact, erectile difficulties can sometimes be the first sign of heart disease. The smaller arteries in the penis tend to narrow years before larger coronary arteries do. That's why I tell my patients, what's good for your heart is good for your performance. After 70, blood vessels become less elastic, and the inner lining, what we call the endothelium, may not release enough nitric oxide, a key molecule that signals blood vessels to relax and expand. Without that, blood flow becomes restricted. But the good news is, the vascular system is incredibly responsive to lifestyle changes. With the right habits, you can literally retrain your arteries to function better. I encourage all my patients to move daily, Even 30 minutes of brisk walking 5 days a week can dramatically improve endothelial function and circulation. Gentle resistance training or yoga can also help maintain flexibility and support overall vascular tone. Exercise increases nitric oxide production, reduces blood pressure, and keeps arteries healthy. Nutrition plays a major role too. Diets rich in antioxidants, leafy greens, berries, olive oil, and nuts protect blood vessels from oxidative stress. I also recommend foods that are naturally high in nitrates, like beets and spinach, which the body converts into nitric oxide. Limiting processed foods, salt, and sugar helps prevent vascular stiffness and inflammation. Of course, we must also manage the silent threats: high cholesterol, diabetes, and hypertension. These conditions damage the endothelium and reduce blood flow over time. Regular checkups and early treatment can prevent a lot of frustration down the road. I also talk to my patients about moderating alcohol and quitting smoking. Both directly constrict blood vessels and reduce oxygen delivery, two of the biggest enemies of performance. For men who need an extra boost, there are modern medical options available. We now have evidence-based therapies like low-intensity shockwave treatment, which helps regenerate tiny blood vessels and improve penile circulation naturally. There are also medications that enhance nitric oxide signaling for men who need short-term support. But the ultimate goal isn't just to create a temporary fix. It's to rebuild a strong, responsive vascular system that supports energy, stamina, and intimacy long-term. When blood flow improves, everything else improves. Your heart feels stronger, your brain sharper, and your body more alive. So, I tell my patients, think of your vascular health as the foundation of your vitality. When you care for your arteries, you're not just improving intimacy. You're protecting your entire future. Good circulation is truly the lifeline of longevity, strength, and performance at every stage of life. When men think about improving stamina or intimacy, very few ever consider their pelvic floor. Yet this is one of the most powerful and overlooked areas of men's health. The pelvic floor muscles form a hammock-like structure that supports the bladder, prostate, and rectum. These same muscles are responsible for control during intimacy, urinary continence, and even the sensation of pleasure. When these muscles weaken with age, which they often do, men start to notice changes: reduced firmness, early release, leakage, or a general loss of strength and control. After 70, muscle mass naturally declines, and that includes the pelvic muscles. But just like the biceps or the core, the pelvic floor can be trained and strengthened at any age. The key is awareness and consistency. I often tell my patients, you can't strengthen what you don't feel. Many men aren't even aware of where their pelvic muscles are, or how to engage them properly. The first step is learning to identify them, usually by trying to stop the flow of urine midstream. The muscles you activate in that moment are your pelvic floor. Once you can recognize that feeling, you can begin to train them deliberately. I recommend doing controlled pelvic floor contractions, sometimes called Kegel exercises for men, several times a day. Start by tightening those muscles for 3 to 5 seconds, then relaxing for the same amount of time. Gradually work up to sets of 10 repetitions, 3 times a day. Over weeks and months, you'll notice better control, stronger firmness, and greater endurance. It's a subtle exercise, but incredibly effective when done consistently. What's fascinating is that research has shown men who perform regular pelvic floor training can experience significant improvements in both erectile function and control. It enhances blood flow to the pelvic region, increases nerve sensitivity, and improves coordination between the brain and body. In many cases, I've seen older men regain confidence and intimacy without the need for medication, simply by dedicating themselves to this practice. I also encourage incorporating breathing and posture into pelvic health. Deep diaphragmatic breathing helps coordinate abdominal pressure and pelvic muscle engagement. Good posture ensures that the pelvic muscles are aligned and not under chronic tension. Sitting for long periods, which compresses the pelvic floor, can weaken it over time, so taking breaks to stand and stretch is also beneficial. For men who have undergone prostate surgery or struggle with incontinence, specialized pelvic floor physical therapy can be transformative. Working with a trained therapist provides biofeedback, ensuring the exercises are done correctly and progressively. Ultimately, pelvic control is about reconnecting with a part of the body that most men ignore until problems appear. Strengthening these muscles restores more than just physical function. It restores confidence, control, and a sense of mastery over one's own body. At any age, but especially after 70, improving pelvic health can reignite vitality and bring back the natural rhythm and satisfaction that makes intimacy deeply fulfilling again. It's one of the simplest, safest, and most empowering methods any man can start today. When we think about stamina control and intimacy, we often focus on the physical, hormones, blood flow, and muscle strength. But the truth is, the mind plays just as big a role, sometimes even bigger. I've seen men with perfectly normal testosterone levels and excellent vascular health who still struggle with intimacy, simply because of what's happening in their thoughts. The connection between the brain and the body is incredibly powerful, and it determines how confident, responsive, and fulfilled we feel. As men age, it's natural to become more self-aware or even anxious about performance. A single disappointing experience can create a loop of worry. What if it happens again? And that anxiety alone can make it happen again. It's not weakness, it's biology. When the brain senses fear or stress, it releases adrenaline, which constricts blood vessels and redirects blood flow away from the pelvic region. In other words, stress shuts down the very system you're trying to activate. That's why I often tell my patients before we treat the body, we have to calm the mind. One of the most effective strategies is mindfulness. Taking a few minutes each day to breathe deeply, clear the mind, and focus on the present can reduce cortisol levels, improve blood flow, and restore balance. Mindfulness isn't about meditation in a religious sense. It's about awareness. When you slow down and tune into your own body, you begin to rebuild that connection between thought and response. Many of my patients have found that incorporating just 10 minutes of quiet reflection or controlled breathing before sleep helps them not only rest better, but also perform better. Emotional connection also plays a huge role. Intimacy isn't just physical contact, it's trust, communication, and comfort. I encourage men to talk openly with their partners about their concerns instead of hiding them. When both partners understand what's happening, the pressure eases and connection deepens. That emotional safety allows the body to respond more naturally. Depression and loneliness are also silent contributors to declining performance. As men retire or lose social roles, they may feel less purposeful, which affects confidence and self-image. Addressing these feelings through counseling, community involvement, or even volunteering can reignite passion and drive. A man who feels emotionally fulfilled is far more likely to feel physically vibrant as well. I often remind men, intimacy begins long before you reach the bedroom. It begins in how you think, how you take care of yourself, and how you connect with those around you. When you cultivate a calm, confident mindset and nurture emotional connection, your body follows naturally. The mind and body are not separate systems. They are partners. When one is neglected, the other struggles. But when they work together, even at 70, 80, or beyond, a man can experience deep satisfaction, energy, and control. The greatest performance booster isn't a pill or a supplement. It's peace of mind, purpose, and emotional connection. That's what truly keeps a man strong, from the inside out. As we bring everything together, I want to leave you with a simple but powerful message. It's never too late to take control of your health, your energy, and your intimacy. I've treated men in their 40s, 50s, 70s, even their 90s. And one thing I've learned is that age alone does not define vitality. What truly defines it is mindset, consistency, and the willingness to make small, meaningful changes every day. Many men believe that declining stamina or performance is just a natural, irreversible part of aging. But the truth is, much of what we think of as aging is actually the result of neglect. Neglecting our hormones, our circulation, our muscles, and our emotional well-being. The body has an incredible ability to adapt and heal, even in the later decades of life. Once you start addressing the root causes, balancing hormones, improving vascular health, strengthening the pelvic floor, and calming the mind, your body begins to respond in ways that often surprise you. I've seen men who could barely manage a walk around the block regain their energy, strength, and confidence within a few months of consistent effort. I've seen couples rediscover closeness and connection after years of frustration, simply because they started communicating openly and addressing these issues together. And I've seen how that renewed sense of control and intimacy transforms not just physical health, but emotional well-being too. One thing I always remind my patients is that progress doesn't have to be dramatic to be meaningful. A little more sleep, a few minutes of exercise, a shift toward cleaner food, a habit of daily pelvic exercises, or even taking time each morning for quiet breathing. These small actions build on each other. Over time, they create a momentum that reignites the body's natural vitality. It's also important to stay proactive. Don't wait for problems to become crises. See your doctor regularly. Check your hormones, manage your blood pressure, and pay attention to how your body feels. Early awareness gives you more options and better outcomes. Health is not about perfection, it's about paying attention. Above all, remember that intimacy is not just about performance. It's about connection, presence, and confidence. When you feel strong in your body, calm in your mind, and open with your partner, everything else naturally improves. So, if you're over 70 and wondering whether it's too late to make a change, I'm here to tell you it's not. The science and my experience both prove that men can maintain strength, vitality, and fulfillment well into later life. You have the power to transform your health from the inside out. Start with one step. Stay consistent and give your body and mind the care they deserve. Because no matter your age, you still have the potential to live, love, and thrive fully every single day. When I reflect on everything we've discussed, hormones, circulation, pelvic strength, and the mind-body connection, it all points to one truth: men are far more resilient than they realize. The body may age, but the capacity for renewal never disappears. Every cell in your body has the ability to respond to positive change, no matter how many birthdays you've celebrated. The key is not to accept decline as destiny, but to understand that you can influence your health, your vitality, and your sense of intimacy through awareness and consistent effort. I've spent my career helping men rediscover their strength and confidence. And what I've learned is that transformation doesn't happen overnight. It begins with a shift in mindset. A decision to stop viewing aging as a limitation and start seeing it as an opportunity. After 70, life can be rich, powerful, and deeply connected if you give your body the attention it deserves. The same principles that keep your heart strong, your mind sharp, and your relationships healthy also sustain your intimacy and stamina. It's all one system. And when you nurture one part, you uplift the whole. Many men tell me they wish they had started sooner. I tell them the best time to start was yesterday. But the second best time is today. The body responds quickly when treated with respect. A simple walk each day strengthens the arteries, mindful breathing calms the nervous system, resistance training boosts testosterone, and good nutrition nourishes every cell. It's not about perfection or complex routines. It's about consistency. Those small, steady actions compound into remarkable improvements over time. I've also seen how restoring intimacy changes more than the physical. It changes relationships, marriages, and families. When a man feels confident in his body, he shows up differently. He communicates better, he listens more, and he feels more connected to the people he loves. Health isn't just about living longer, it's about living better. With joy, strength, and emotional presence. So as you move forward, remember that vitality is not lost with age. It's built through daily intention. Take care of your body with movement, fuel it with clean food, rest it deeply, and calm your mind. Reconnect with your partner, your passions, and your purpose. These are the real medicines for longevity. I've seen men in their 70s and 80s live with more energy and satisfaction than they ever had in their 40s. The secret isn't youth, it's balance, awareness, and care. That's the proven path to better intimacy and lasting control. And I want every man listening to know your best years can still be ahead of you. All it takes is a commitment to start, one small, intentional step at a time. Because true health isn't just about adding years to your life, but life to your years.